Hello, my name is Joel Hanhart. I'm speaking from the eye department at Szаар Zedeka Medical Hospital in Jerusalem on behalf of Shlomo Winker from the Tel Aviv University, Adi Abulafia, David Sadok from Szаар Zedeka. All of us in Jerusalem are affiliated with the Hebrew University of Jerusalem. The topic I want to discuss with you is the growing role of telemedicine and artificial intelligence in the medical encounter and what we are daily doing as ophthalmologists. And indeed, I think we are just facing a major revolution. We should already start thinking of what it implies in terms of relation with our patient, but also more globally in terms of what it means to be an ophthalmologist in a few years from here. I hope I will be able to. A replic relationship, the traditional model available since medicine has been practiced, where the clinician physically encounters a patient, and there is an exchange between both of them. The clinician asks questions, the patient gives his input, and both are actually communicating in the same space. And then decision is taken and communicated to the patient, and a treatment is prescribed. But when you consider telemedicine, so the rules of the games are changing indeed, because there are no more physical encounter between the clinician and the patient, both of them being distant. And we can use smartphones, all kind of things. We can just communicate through images. Patient can have his images taken at a certain point. He can have his retina, for instance, pictured by OCT, and those images communicated to the clinician who will take a decision and communicate it to the patient. So there is no more physical encounter in the traditional sense we knew before it. And this change has a big impact on the therapeutic relationship, and it's already here. We have experienced here we have experienced it during the COVID crisis, for instance, during the first wave, during which the patients were at home or just came for having some OCT, and there have been a lot of publications showing that you can reach a certain degree of accurate diagnosis without checking physically the patient, without seeing him. You can just communicate the conclusions, ask him to come for treatment or for a new encounter, for a new picture session on another time, and then you can follow manage the retinal condition in our instance as a retina specialist. Another major game changer is artificial intelligence. So all kinds of algorithms are incorporated in softwares, and then there is no more need of the clinician input in the decision process, because the machine, the device itself can just look, so to call, on the pictures and take a decision. So we are starting to live in this new world where beyond the physical distance, there is a new role devoted to the clinician now. For sure, it will not be completely abolished, but the task is not exactly the same. We have to understand what the device is doing, what kind of operations are performed, but we don't need to actually, or we won't need in the near future to review every picture taken for the same patient. The machine will do it, the software will do it. So a few numbers, we can do it. It's quite easy to do. It's just to perform a Medline survey to review the number of publications. So it's a quantitative study here. We performed at Szаар Zedeka with all the authors I mentioned in the beginning, and we had a look on the numbers of publications, of peer-reviewed ophthalmology publications relating to telemedicine or artificial intelligence. So in the 90s, there were less than 400 such publications. In the 2000 years and for the next decade, you can see the figures here. So there is a huge increase, but the big change has occurred for the last decade, or since 2010. You can see that there is an increase of 2,000%. So it's something completely amazing when you look on that. And what's more interesting for us as retina specialists, or as when we want to look more specifically on what it means in our current approach to the patients. So the top 3 topics on which there were publications in telemedicine or artificial intelligence were diabetic retinopathy for both telemedicine and artificial intelligence, followed by glaucoma. And then for artificial intelligence, you had AMD, age-related macular degeneration. And in telemedicine, it was pediatric ophthalmology. So you can see there was a huge impact of artificial intelligence on what's going on in retina, with diabetic retinopathy and AMD being in the forefront of all this revolution. If you want to see it with other figures, so you can see retina and artificial intelligence on the left here, a lot of publications, but even more, that's a pace of increase, even more for the last decade. And there was also a huge increase in publications related to telemedicine and retina on the right of your screen. And to see it graphically, so you see the number of retina publications based on artificial intelligence that's clearly exponential, with a huge increase for the last decade. And when you combine all of those and you see what kind of publications have been related on artificial intelligence and telemedicine that related to retina, you can see also these figures. So COVID-19, for example, has accelerated this trend. Is that something that is already coming? The revolution is happening right now. And the subspecialty of ophthalmology retina is radically changing. Over 1 decade, the number of publications have skyrocketed, and that's most impressive for artificial intelligence, almost 1,000 pace. So it's something quite crazy when you think of that. Telemedicine is already here. We use it during COVID-19 when populations are exposed to war or any kind of conflict. So there is no access to the ophthalmology community, and under certain conditions, you can continue to perform medicine, and you want to continue to perform medicine, so through the smartphones or more elaborated technologies. But what we need to understand is that artificial intelligence is coming, and the change it will induce is massive, because when you see the previous graph, you see that there are a lot of publications on that topic. And we also know, on the other hand, that there is an accelerating transition between purely academic research and clinical applications. So things are already here, or just here. Now, when we try to look more deeply on what it means, I come with a more wider view, not just as retina specialist, but we are changing, something is changing in the very core of the therapeutic relationship. From Hippocrates, it started as an encounter, physical encounter between a clinician and a patient, and some kind of discussion, some kind of tests that were done, starting with physical examination and then prescription of some kind of drug. But now we are in another world, in another reality. You see the patient is physically disconnected from the clinician. Algorithms are making a major part of the work, and there is not such a therapeutic relationship based on close proximity between them. So it's high time, I think, we consider the global impact of such technologies beyond purely technical aspects. A lot of things have been discussed in all kinds of forums, but we need to think more globally, I think, and because this change is deeply impacting the way we practice medicine at all. So as retina specialists, specifically as ophthalmologists more largely, we see that, but it will impact by the end of the day, most part of what we know today as medicine, and the repercussions can be very varied. So you can think of special consequences of that in the kind of architecture you need for hospitals, or when you look at the country or the city as a whole, it needs some urbanistic kind of thinking. There are also all kind of existential implications of that. And then we need to resort to other kinds of disciplines, such as psychology. We need also to guarantee equity in access to this kind of care. It's not something that is obvious. For instance, we are dealing with aging population, and high-tech technologies are maybe not the best way to deal with the special needs of these populations. So sociology can also be called to give some input in this global discussion. And we are actually facing some deep change in the very core of the therapeutic relationship. And so it has philosophical implications. Anthropology can be of some help to try to understand what implies when we speak on that, because we all know that a medical doctor is present. It can deal with all kinds of complaints of the patient, not always purely technical, medical. Sometimes the patient comes with other kinds of complaints, and it's related to some family disturbance, to other things, to some crisis, and the computer for sure cannot detect that, and it cannot give a proper answer to that. And there is also a global thinking with healthcare systems, economics, training, et cetera, et cetera. There is no end to the questions that are that those kind of major changes involve. And I thank you for your help. It's just a discussion that is starting. I hope we'll be able to physically encounter beyond all the screens and discuss all the impacts of such revolutions occurring really under our eyes. Thank you so much.